session on newborn care. Now, I first of all thank you, Baby Chakra app for connecting with you people. And I congratulate the mother, all the pregnant women, and who have given birth. Congratulations to you and your baby. So today session, I'll be discussing about in the next 10 to 15 minutes about the newborn care. So many of the times as a pediatrician and neonatologist, I see many mothers coming with a lot of doubts and getting a list of questions to me when they come to my OPD after 2 to 3 days after the birth when they discharge from the hospital. So now in this video, I would like to give a small talk about the newborn care. When I tell the newborn care, it's the care from the time of the birth to the first 30 days. So in the first, there are two stages I divided it into. One is the immediate care that the baby gets in the hospital by the doctors and the staff and where the mother is also involved. And the second thing is the care of the baby in the home when the baby get discharged from the hospital, and then when the baby reaches home, mother will have many doubts what to do with the baby, things, how to bath the baby, and how to take care of the feeding, and how to know whether the baby is normal or not. So in the next few minutes, I'll be discussing all this with you. If any doubts you have, you can give your questions in the comment section. I would like to answer them. So now immediate care of the newborn starts with disconnecting the baby from the mother. Through generally, whenever the baby is in the womb, the mother and the baby will be connected with an umbilical cord. So when the umbilical cord is cut and the mother and the baby is divided, the baby will have independent life. And once the baby comes out, so first important thing is we generally take care of the baby and use skin to skin contact with the mother. So when the baby is given skin to skin contact with the mother, the baby's whatever the vital parameters get stabilized, and then it makes the baby to maintain the blood sugars well, and it also stabilizes the breathing of the baby. And for the mother also, if any excessive bleeding is there, it can help in decreasing the excessive bleeding, and it helps in the bonding with the mother. So that's the reason we use skin to skin contact with the mother soon after the baby is born. And in some situations where the mother underwent had some medical issues or underwent some cesarean section, and some situation we may not do sometimes, but many of the times skin to skin contact with the mother and the baby is very important thing. And the second thing, soon after the baby is born, we give vaccine something called as hepatitis B and vitamin K injections. Vitamin K is an injection which helps the baby to prevent bleeding, and there is something called as hemorrhagic disease of the newborn, which helps the babies to get prevented from that. So this is generally important for the babies in the first few minutes of life. And there are two other vaccines we give within 24 hours is the BCG and the polio vaccine. So next, like whenever the babies got delivered, the first 24 to 48 hours, very important thing is the main important thing when the mother is in the hospital is to learn how to establish the feeding, how to latch the baby and feed the baby, and after feeding, how to birth the baby and handle the baby. So these are the very important things that many of the mothers, initially the first mothers, means primary mothers who have given birth to the first baby, they will have a lot of issues with the feeding. And many of the times when feeding doesn't happen properly, the babies may lose weight and then they'll end up in other issues. So very important thing is initially feeding and establishing the feeding and mother learning the feeding is very, very important. The other things we do in the first 48 to 72 hours is we check for the hearing of the baby. So we do something called as hearing test. There is something called OAE. So this hearing test generally we do at 24 to 48 hours of the birth of the baby. So initially, sometimes the first hearing test, sometimes baby may not pass. So sometimes the baby may not pass in the first or second attempt also. That is mainly because of the fluid in the ear. So, but nothing to get panic about that, and we will be keep on checking that. And if the baby still doesn't pass the hearing test in first 1 or 2 sessions, then we will put you to the audiologist or an ENT doctor. And other important thing in the baby in the first 48 to 72 hours of life is jaundice. So all the babies born on this earth will have jaundice. So, but if the level of the jaundice is very high, so that depends on the different parameters of the mother's blood group, baby blood group, baby's weight, and the gestation of the mother. And depending on all of that, we look into the jaundice. And jaundice is nothing but the yellowish discoloration of the eyes as well as the skin of the baby. So whenever the baby is looking more yellow, we do something called as serum bilirubin test. So which gives the jaundice level. So if the level is very high, and baby need to be started on treatment called as phototherapy. So this generally happens in the first 1 week of life of the baby. Why? Because in babies the liver will be in an immature condition. In the first 7 days, the liver will not be in a very active process to excrete the jaundice. In that situation, the jaundice starts getting accumulated on the skin, and the baby becomes looks more yellow. So once after 7 days, generally the jaundice will get washed out as the liver takes up the action, washed out in the urine and the stools. The other important thing we do is CCHD, something called as congenital heart disease screening. So in the first 24 to 48 hours, we do screening for the normal levels of the baby, like using a pulse oximeter. We do the screening for the SpO2 levels. If the levels are less in all the four limbs, then we may need to get a 2D echo done. And other very important thing is breastfeeding. So many mothers will have issue with the breastfeeding in the first 1 or 2 days. They'll be getting only few amount of milk, but many of the times, like we start encouraging the mother to feed the baby. So initially, because the fluid will be filled in the tummy of the baby, there is something called as amniotic fluid. Baby may not sometimes feed well, but you have to keep on feeding the baby every 2 to 3 hours. And establishing the breastfeeding is very important. And every time, whenever you feed the baby, it should be like 10 to 15 minutes. And this 10 to 15 minutes in every 2 to 3 hours gap. First few drops, whatever the baby gets, is something called as colostrum. So that is very rich in antibodies as well as and many of the healing factors, as well as something called as there's a high protein liquid, so which helps the baby to be away from the risk of asthma, eczema, and type 1 diabetes, obesity, and SIDS. Okay. So if mother milk is not at all available, and if the baby is losing a lot of weight, then we prefer to give mother and extra supplements to increase the milk. And in a worse situation, we may need to give formula milk to the baby. And after every feeding of 10 to 15 minutes, burping the baby and keeping the baby upright and burping the baby for 10 to 15 minutes is very important. And there is no need for the baby to fed with any water or any juices apart from the mother's milk. So if mother's milk is not available, then another option is for the formula milk. So in the first 48 to 72 hours you are in the hospital, so these are very important that the doctor and the staff available in the hospital is assist you with all this. And second part comes now, like when you go home and discharge from the hospital. So many of the mothers will have to independently take care of the baby, then they will have a lot of issues. And when you go home again, the same thing, the breastfeeding has to be continued every 2 to 3 hours once for 15 to 20 minutes. And if the baby is not able to take the feeding, direct breastfeeds, you may need to express the milk and give the palada, at least like how much the baby needs to take. And this process has to be done every 2 to 3 hours once and at a max of 4 hours. And if the baby is sleeping for more than 4 hours, you need to wake the baby up, unwrap the baby, and flip on the soles and toes. And you need to gently massage on the side of the ears and makes the baby to wake up and make the baby to feed. So you should not leave the baby sleep for more than 4 hours. Why? Because so there may be in the first initial days, if the baby doesn't feed for like more than 4 hours, they may lead to something called as low sugars or hypoglycemia. And other important thing is many of the mothers face the problem of latching the baby and holding the baby, which has to be learned. And if you have any issue, you can meet the lactation specialist or your gynecologist. The and other one important thing, many of the mothers ask me that how many times the baby need to pee in a day. So in the first 2 to 3 days, baby may sometimes pee for 1 to 2 times a day, which is normal. And after like 2 to 3 days, the baby has to pass at least 4 to 6 times in a day. So if you cannot be able to appreciate the peeing of the baby, then each time when you change the diaper has to be heavy enough. And each time, like at least in a day, 4 to 5 diapers, full diapers needs to be there. And if the baby is not peeing, at least like 4 to 6 times, that indicates the baby is getting dehydrated and mother's milk is not sufficient to the baby. In that situation, you need to check the weight of the baby, and then you may have to increase your milk, or if your milk is not available, then you may need to supplement with extra milk, either like formula milk or donor breast milk. And baby crying while peeing is very much normal, nothing to worry. So it doesn't mean that the baby has some infection. And other question comes to me is how many times my baby need to poo. So generally babies, newborn babies, in the first whenever they are born, they pass a motion something called as meconium, which is a mixture of all the contents that the baby has swallowed when the baby is in the mother's tummy. So once the baby passes the meconium in the first 24 hours, then the baby's gut is normal. So after that, if the baby is passing motion, once in 2 to 3 days is also normal, and passing motion 10 to 15 times in a day is also normal. So if the motions are sometimes little watery, nothing to worry at all. If the baby is not feeding, had vomiting, any abdominal distension, and has not passed for motion for 3 to 4 days, and crying a lot, then it's a concern. And in that situation, you need to come and visit the doctor. So we may have to sometimes see any other issues in the tummy. So other problem we generally see is should I wear my baby diapers? So the very important thing is many of the times, so when you are at home, better to avoid diapers, keep cloth nappies, and it helps the baby from prevention of diaper rash. And every time whenever you put the diaper, apply a cream onto the diaper area so that it will make the baby to uh, prevent from a diaper rash and diaper dermatitis. And sometimes we see small kind of blood stain in the diapers. Should I get worried of my baby diaper stained red? No, because this redness is mainly because of something called as uric acid crystals. So these are normal things that baby passes while peeing, and because of that, the diaper stains sometimes red. So that is a very normal thing. And sometimes we observe vaginal discharge coming out of from the female babies. That is also nothing of concern. So this is a normal thing that happens because of the maternal hormones. The next thing is color of the baby. So the baby where it should be always pink in color, and the palms and soles should be always pink. So if you notice the palms and soles in bluish discoloration, that indicates the baby has something called as hypothermia. The baby's temperature, the baby's temperature is going down. In that situation, you may need to you may need to and temperature you may need to maintain the temperature of the baby. So generally the temperature of the baby should be 36.5 to 37.7 degrees centigrade. Anything less than 36.5 is called hypothermia. So in that situation, you need to wrap the baby well, and then you need to warm the baby. If in that situation, you can also keep the baby skin to skin contact with the mother to maintain the temperature. And other thing is, if the baby is have more temperature, if more than 37.5, then it's considered as a fever. In that situation, you should unwrap the baby, check the temperature, and if it is persistently more than 37.5, then you need to consult the doctor and look for other signs of infection. So coming to the breathing of the baby, babies are nose breathers, and whenever they breathe, they will have noisy breathing. And generally the baby should breathe 50 to 60 times per minute. So if you see the breathing of the babies, they will be shallow and slow. This is something called as cluster breathing. And as the nostrils of the babies are little narrow, in that situation we need to because of that they will have something called as noisy breathing. They feel little difficulty in breathing. So whenever the situation of noisy breathing is there, you need to put some nasal drops in the nostrils and wait for 5 to 10 minutes and feed the baby. So when the nose become clear, then automatically the baby will be able to latch well and then feed, take the mother's milk. So coming to the cord care, the cord generally falls in 7 to 14 days. If any pus or any blood discharge on the umbilicus, that's a normal thing, nothing to get panic. Any foul smelling or redness around the umbilicus, you need to uh, consult the doctor. And always keep the cord to be dry after giving the bath. And next thing is the sleeping pattern. Many of the babies which are born, so they sleep more in the morning and will be more awake in the night. This is a very common thing, nothing to get worried about that. So if the baby is crying excessively in the night, the baby needs little warmth, and then you have to swaddle the baby or do skin to skin contact. So other thing many of the mothers are worried about are the hiccups and sneezing. So hiccups are a normal thing to the baby. No need to give any other water or extra milk to the baby whenever the baby has hiccups. So just hold the baby upright for some time, and that will help the baby to get better from the hiccups. And sneezing is also a normal. That doesn't mean that the baby has some cold and no need to give any medication except the saline nasal drops. And many of the babies you see straining and crying while passing motion and urine. That's a very normal thing. I think to get panic about that. And it doesn't mean that the baby has some constipation issue. And vomiting. So many of the babies after feeding they'll have little vomiting from the mouth. This is a very normal thing. These are something called as happy spits. Generally, the vomitus of the baby will be something like curd or milk. If apart from this, if the baby's vomitings are like yellowish or greenish in yellow, or if any abdominal distension is there, then you need to seek a medical attention, and we may have to look into any other issues with the baby. So, other important thing you need to other important, main important thing you many of the mothers ask me is the bathing. So every daily the baby can be bathed, and if you're giving an head bath, it's better to do it an alternate day. And oil massage need to be done. Take any oil is either almond oil or olive oil. You can give a do gentle massage of the baby, and then wait for 10 to 15 minutes and keep the baby for 15-20 minutes and given hot water bath, where the hot water should not be very hot, which can cause damage to the skin of the baby. And gently you can wipe the baby. Don't apply any powder or do samrani. Generally, the some people may do that, and don't apply kajal to the eyes. That can cause infection to the baby. So, and you can after the bath for 15 minutes, you can wait and then apply a thin layer of moisturizer onto the baby's skin. That makes the baby's skin to be very soft. So you need to avoid powders and any dupe or samrani because that makes the baby to have allergy. Other very important thing is regular monitoring of the weight. So whenever you visit the doctor, after 2 to 3 days after your discharge, you need to check the weight of the baby. So that will help you to know whether your feeding is good or not. Okay. And here I'll be telling some few warning signs which you need to look into uh, whenever the baby is whenever the baby has few of these danger signs, you need to consult the doctor. So first important thing is fever, and if the fever is greater than 35.5 degrees, then you need to consult the doctor. If the baby is having poor feeding or sleeping more than 6 hours, any vomiting, greenish vomiting mainly, and then bluish discoloration of the upper limbs and lower limbs, and fast breathing, and if the breathing is more than 16 times per minute, and decreased urine, and jaundice, when the baby is looking more jaundice and very dull and not feeding well because of the jaundice, and crying excessively, which is something called as unconsolable cry. So whenever you take the baby, generally automatically the baby starts should stop the crying. But if the baby is continuously crying without if after you console the baby also, then it's a concern, and the baby need to be shown to a doctor. And other important thing is pus discharge from the umbilicus. So these are the very important danger signs which you need to observe in the baby. If any of these signs are there, you need to consult the doctor. So with this, I would like to end this. I am open for the questions, and if you have any questions, you can uh, ask in the comment section. I would like to answer them. So I have a question here. So mother asks like this, changes in the baby's poo color should be a cause of concern. Yeah, generally, initially, whenever the baby is in the first 2 to 3 days, they passes blackish motion. That is something called as meconium, which are the substances that the baby has taken and swallowed when the baby is in the womb. And after 2 to 3 days, once the mother's milk is established, slowly the poo starts changing the color like greenish and then greenish yellow. And once the mother's milk is completely sufficient to the baby, then it changes into yellowish color. So sometimes because of the formula milk or because of some food mother has taken, the poo may sometimes may be like greenish in color, which is a normal thing, nothing to worry about that. So another question here, a baby should cry a total of about 1 hour per day. It's not like that. So baby cries for different reasons. Actually, so figure out the reason why the baby is crying. It doesn't mean that the baby has to cry daily a fixed time. There is no strict and fast rule for that. And generally, babies cry for different reasons, and you need to figure out the reason, and then you need to correct the problem. So babies can either cry for feeding, or if the diaper is wet, they can cry, and if they are more hungry, or sometimes because they are feeling cold and therefore they want the warmth. So for these reasons the baby can cry. So you have to figure out the reason and you need to address the concern. So there is another question a mother asks, is it true babies tend to double their birth weight by their fourth month of life? Yes, the baby's it's not fourth month, the baby has to double the weight by fifth month. So if the baby is born by 3 kgs at birth, by fifth month the baby has to become 6 kgs. So it has to happen. That indicates the mother baby is getting sufficient feeds from the mother. So in the first initial month, when the baby is born, the baby loses almost like 10% of the body weight in the first 1 week, and by 15th day the baby will regain the birth weight, and from the 15th day baby starts growing, and from 15 days to 45 days when you come for the next vaccination the baby has to gain at least 600 to 900 grams. I mean to say that 20 to 30 grams per day the baby has to gain the weight. So this is there is another question, what is the best way to get a baby to go to sleep? So many of the times, so this is a very difficult question to answer. So the baby doesn't sleep for many reasons. So you have to figure out what is the reason why the baby is not sleeping. So many of the times when you feed the baby, so generally they fell asleep easily. And in the night time, see that the room is completely dark, and then see that the keep a small light in the room that will make the baby to feel darker, and then the baby can sleep well. So, but it's very difficult question to say what is the best way, because when you know the reason why the baby, what is the reason the baby is not sleeping, then after correcting that, the baby will have comfortable sleep. So it can be a feeding, it can be a light, it can be other reasons, diaper wetness, and baby has food or feed the diaper. After changing, the baby can sleep well. Okay. So yeah, there's another question. Do all babies get jaundice after birth? Yes. So every baby born, as I was telling before, every baby born on this earth will have jaundice. But there is certain level where the jaundice, if it becomes more, it can go to the brain and then stain the brain. That is the reason. So we generally measure the levels of the jaundice. If the levels are more, approximately in a like full term baby, we call it, if the baby has crossed 38 weeks and was as of good weight, like 3 to 2.5 to 3 kgs, generally 11 to 12 milligrams per year is a normal jaundice level. Anything beyond that, we need to treat. But all the babies will get jaundice. If the level is less, then nothing need to be done. You can just expose the baby the early morning sunlight. And if the baby's value is more, then we need to treat with the treatment called phototherapy. So this generally happens in the first 7 days. After 7 days, the liver once get matured, the jaundice gets excreted, and the poo becomes yellow because of that. It's a, uh, it's a normal thing for the baby. So hope I have given all the information in the short session here, and hope I have cleared all your questions also. And a take home message is, so take care of your baby. Like main important thing is breastfeeding, breastfeeding, breastfeeding. So proper breastfeeding, and then burping the baby, and then keeping the baby in warmth makes the baby to grow well. So this is very important. As the feeding of the baby is good, baby's growth will be good, and then all other issues can be assigned. And other very important thing is whatever the danger signs I told you, you have to keep in mind. So if any of these signs, you need no need to give any self medication at home. Immediately consult the doctor nearby and take his advice. So with this, I will ending up the session. Uh, I think I'm clear with all the things. If any doubts, something you have, you can send me in the comment section, and then I can answer you uh, clearly. Thank you very much.